Hey everybody, Dennis here with Respiratory Sensei, and we are on Egan's Fundamentals of Respiratory Care, Chapter 9. This is Part 2. Remember, Chapter 9 is about anatomy and physiology, and frankly, there is a lot of information in here, a lot of pictures that you probably need to look at, and you may need to study this chapter intensively if you're in school. Your teachers will probably make sure you understand that. But remember, we're covering this in relationship to what is needed in real life. What anatomy and physiology things are you talking about every day when you're talking with physicians or giving a report in the respiratory room? Well, not much. So we don't talk a lot about anatomy and physiology, and well, unless we're trying to sound like a nerd, right? And then the other question we ask is, what's on the NBRC exam? Good news for you is that the NBRC doesn't typically ask you anatomy and physiology questions. In fact, it's not even on their content matrix, their detailed content outline. So we don't see just simply a lot of recall questions about what's the name of this airway or what's the name of this segment of this lung. There is, however, just one thing that I want to cover from Chapter 9, and it has to do with accessory muscle use. So right now, typically, as you're breathing, you're probably just using your diaphragm if you're at rest, but if you do any kind of exertion like climb stairs, go jogging, kind of walk fast into the hospital because you're late for your shift, whatever that is, that's when these muscles all around your rib cage can contract and they can expand and help you breathe just so they kind of lower the work of breathing. Well, it's normal for accessory muscles to be used whenever you are doing something vigorous. However, and this is what you need to know for the NBRC exam, it would not be normal if you see accessory muscle use at rest. That's when somebody's in severe distress. And you might see this with COPD patient or even asthma patients that are in distress or having bronchoconstriction right now. If you see accessory muscles use at rest, then what you're probably concerned about is that you're probably this close to having an emergency and you need to intervene right away. I'm Dennis with Respiratory Sensei. Remember, we're traveling through the Egan book and shorts. If you missed the previous ones, be sure to subscribe and go back and look at those. And if you don't want to miss any future ones, be sure to subscribe and we'll see you next time.